Hey everyone, welcome back to the channel. Today we're talking about something that affects millions of people worldwide, but is often misunderstood: lupus. If you've heard of it but don't really know what it is, or if you want to understand it better, you're in the right place. Let's break it all down. What is lupus? Lupus is a chronic autoimmune disease. That means the body's immune system, which usually protects us from viruses and bacteria, mistakenly attacks its own healthy tissues. The most common type is called systemic lupus erythematosus, or SLE for short. And here's the tricky part. Lupus can affect almost any organ in the body: skin, joints, kidneys, heart, lungs, even the brain. Common symptoms. One of the reasons lupus is so complicated is because its symptoms are different for everyone. But some of the most common signs include extreme fatigue that doesn't go away with rest, joint pain and swelling, often mistaken for arthritis, a butterfly-shaped rash across the cheeks and nose, hair loss and sensitivity to sunlight, fevers, mouth ulcers, and unexplained weight changes. And here's something important. Lupus symptoms often come and go in flare-ups. People may feel fine for weeks or months, and then suddenly experience a flare triggered by stress, infection, or even sunlight. Who gets lupus? Lupus can affect anyone, but it's most common in women between 15 and 45 years old. It also affects certain groups more often, including people of Asian, Hispanic, African, and indigenous backgrounds.
What causes lupus? The exact cause isn't fully known. Doctors believe it's a mix of genetics, hormones, and environmental triggers. That means some people may be born with a higher risk, but things like stress, certain medications, or infections can wake up the disease. Complications of lupus. Because lupus is systemic, it can lead to serious complications if it's not managed properly. For example, kidney inflammation, called lupus nephritis, heart disease, and higher risk of stroke, lung inflammation that makes breathing harder, neurological problems like seizures or memory issues. And since the immune system is weakened, both lupus itself and the medications for it can make people more prone to infections. Diagnosis. There's no single test for lupus. Doctors usually use a combination of blood tests like the ANA test, urine tests to check kidney health, and a close look at symptoms over time. That's why diagnosis can take months or even years. Treatment and living with lupus. Right now, there's no cure for lupus, but treatments can help control symptoms and prevent complications. These include anti-inflammatory drugs for pain and swelling, corticosteroids to calm the immune system, anti-malarial drugs like hydroxychloroquine, which help with rashes and fatigue, immunosuppressants to reduce overactive immune responses. On top of medication, lifestyle choices play a big role. Eating healthy, getting enough rest, staying active but not overdoing it, managing stress, and protecting the skin from sunlight can all make a difference. Outlook. Here's the good news. With proper care, many people with lupus live long, healthy, and fulfilling lives. In fact, medical advances over the past few decades have dramatically improved life expectancy and quality of life for people with lupus. Outro. Thanks for watching. Lupus is complex, but the more we understand it, the better we can support those living with it. If this video helped you, make sure to like, share, and subscribe for more health and wellness content. And let me know in the comments, what other conditions or health topics should we cover next? Stay well, and I'll see you in the next video.